Good day, grade 8 students. And welcome to another video lesson in Health 8. Before we start our module, let's answer these questions first, to test how much you already know about the lesson. Read the questions carefully and choose only the letter of the correct answer. Write your answers in your notebook. You will only be given 5 seconds to read the questions and answer, so you may pause the video if you need more time. Are you ready? Let's start. Alright. Let's check your work. Here are the answers to the pre-test. How many answers did you got right? Very good. Before we start our lesson for today, let's have a review first on our previous lesson. Put a check mark if the statement is good for a pregnant woman, and put a cross mark if it is something that a pregnant woman should avoid. 1. Drinking. 2. Carrying heavy loads. 3. Taking vitamin B or folic acid daily. 4. Having regular/necessary prenatal and postnatal checkups. 5. Avoid stressful activities. Alright. Let's now start our lesson for today, which is about prenatal care. Babies born to mothers who lack prenatal care have triple the chance of being born at a low birth weight. Newborns with low birth weight are 5 times more likely to die than those whose mothers received prenatal care. Prenatal care helps decrease risks during pregnancy and increases the chance of a safe and healthy delivery. Regular prenatal visits can help your doctor monitor your pregnancy and identify any problems or complications before they become serious. Prenatal care ideally starts at least 3 months before you begin trying to conceive. Some healthy habits to follow during this period include quitting smoking and drinking alcohol, taking folic acid supplements daily, 400 to 800 micrograms, talking to your doctor about your medical conditions, dietary supplements, and any over-the-counter or prescription drugs that you take, and avoiding all contact with toxic substances and chemicals at home or work that could be harmful. You can start getting prenatal care as soon as you know you're pregnant. It is actually best to see a doctor before you get pregnant. This is sometimes called pre-pregnancy care or preconception planning. But if that's not possible, just begin prenatal visits as soon as you can. The typical prenatal care schedule for someone who's 18 to 35 years old and healthy is every 4 or 6 weeks for the first 32 weeks, every 2 or 3 weeks for the 32nd to 37th weeks, every week from the 37th week until delivery. And your doctor might ask you to come in for checkups more often if you have a high-risk pregnancy. Your first prenatal care visit is usually the longest one. You'll talk with your doctor about your medical history, your husband's medical history, and your family's medical history. Your doctor will give you a complete checkup, usually with a physical exam, and blood and urine tests to make sure you're healthy. These tests can include measuring your height, weight, blood pressure, breathing, and pulse, a breast exam, a pelvic exam, a pap test, testing for sexually transmitted infections, and a screening for diabetes, anemia, hepatitis B, and rubella. Your doctor might also talk with you about your diet and lifestyle, and prenatal vitamins. The most important vitamin you can take is folic acid, which ideally you would start taking even before you're pregnant. Your doctor can give you advice about any changes you can make to have the healthiest pregnancy possible. An ultrasound, also called a sonogram, is a safe and painless way to see inside your body. It shows you and your doctor an image of your uterus and the fetus that helps your doctor find out whether the fetus is developing normally. Your doctor might recommend that you have one or more ultrasounds at different points in your pregnancy. It can be used to check the anatomy of the fetus for defects or problems. Depending on how far along your pregnancy is, ultrasound images help your doctor estimate your due date. See the position of the placenta. See the size, position, movement, breathing, and heart rate of the fetus. See the amount of amniotic fluid in your uterus. And find multiple pregnancies. Ultrasounds can also be used to screen for certain birth defects, like Down syndrome. While most attention to pregnancy care focuses on the 9 months of pregnancy, postpartum, or postnatal care is important too. The postpartum period lasts 6 to 8 weeks, beginning right after the baby is born. During this period, the mother goes through many physical and emotional changes, while learning to care for her newborn. Postpartum care involves getting proper rest, nutrition, and vaginal care. Getting enough rest. Rest is crucial for new mothers who need to rebuild their strength. To avoid getting too tired as a new mother, you may need to sleep when your baby sleeps. Keep your bed near your baby's crib to make night feedings easier. Allow someone else to feed the baby with a bottle while you sleep. Eating right. Getting proper nutrition in the postpartum period is crucial, because of the changes your body goes through during pregnancy and labor. The weight that you gain during pregnancy helps make sure you have enough nutrition for breastfeeding. However, you need to continue to eat a healthy diet after delivery. Experts recommend that breastfeeding mothers eat when they feel hungry. Make a special effort to focus on eating when you are actually hungry, not just when busy or tired. Vaginal care. New mothers should make vaginal care an essential part of their postpartum care. You may experience vaginal soreness if you had a tear during delivery, urination problems, like pain or a frequent urge to urinate, discharge, including small blood clots, and contractions during the first few days after delivery. Schedule a checkup with your doctor about 6 weeks after delivery to discuss symptoms and receive proper treatment. You should abstain from sexual intercourse for 4 to 6 weeks after delivery so that your vagina has proper time to heal. Essential newborn care. This protocol aimed to significantly reduce infant deaths in the country. Essential newborn care is a comprehensive strategy to improve the health of the newborn, through interventions before conception, during pregnancy, soon after birth and in the postnatal period. This protocol will focus on the first few hours of life of the newborn, with the manual guiding the health workers and medical practitioners in providing evidence-based essential newborn care. The APGAR score is a scoring system doctors and nurses use to assess newborns 1 minute and 5 minutes after they're born. Dr. Virginia APGAR created the system in 1952, and used her name as a mnemonic for each of the 5 categories that a person will score. Since that time, Medical professionals across the world have used the scoring system to assess newborns in their first moments of life. The APGAR scoring system is divided into 5 categories. Each category receives a score of 0 to 2 points. At most, a child will receive an overall score of 10. However, a baby rarely scores a 10 in the first few moments of life. This is because most babies have blue hands or feet immediately after birth. This is the table for classifying babies using the APGAR scoring system. You may pause the video to analyze it. The APGAR scores are recorded at 1 and 5 minutes. This is because if a baby's scores are low at 1 minute, a medical staff will likely intervene, or increased interventions already started. At 5 minutes, the baby has ideally improved. If the score is very low after 5 minutes, the medical staff may reassess the score after 10 minutes. And some doctors expect that some babies may have lower APGAR scores. These include premature babies, babies born via cesarean delivery, and babies who had complicated deliveries. A score of 7 to 10 after 5 minutes is reassuring. A score of 4 to 6 is moderately abnormal. A score of 0 to 3 is concerning. It indicates a need for increased intervention, usually an assistance for breathing. A parent may see nurses drying off a child vigorously, or delivering oxygen via a mask. Sometimes a doctor, midwife, or nurse practitioner may recommend transferring a patient to a neonatal intensive care nursery for further assistance. Republic Act No. 9288. An act promulgating a comprehensive policy and a national system for ensuring newborn screening. Newborn means a child from the time of complete delivery to 30 days old. Newborn screening, or NBS, is a simple procedure to find out if the baby has a congenital metabolic disorder that may lead to mental retardation or even death, if left untreated. Most babies with metabolic disorders look normal at birth. By doing NBS, metabolic disorders may be detected even before clinical signs and symptoms are present. And as a result of this, treatment can be given early to prevent consequences of untreated conditions. Newborn screening is ideally done on the 48th to 72nd hour of life. However, it may also be done after 24 hours from birth. A few drops of blood are taken from the baby's heel, blotted on a special absorbent filter card, and then sent to Newborn Screening Center or NSC. The blood sample for NBS may be collected by any of the following: physician, nurse, medical technologist, or trained midwife. Newborn screening is available in hospitals, lie-ins, rural health unit, health centers, and some private clinics. If babies are delivered at home, babies may be brought to the nearest institution offering newborn screening. Results can be claimed from the health facility where NBS was availed. Normal NBS results are available by 7 to 14 working days from the time samples are received at the NSC. Positive NBS results are relayed to the parents immediately by the health facility. Please ensure that the address and phone number provided to the health facility are correct. A negative screen means that the NBS result is normal. A positive screen means that the newborn must be brought back to his or her health practitioner for further testing. Babies with positive results must be referred at once to a specialist for confirmatory testing and further management. Should there be no specialist in the area, the NBS Secretariat Office will assist with its attending physician. The disorders tested for newborn screening are the following. And these are the behavioral development of a healthy baby. And these are the kinds of immunizations a baby should have on a specific age.